Hello, I'm here today with Dr. Perry Schoenecker, who is our current senior statesman for the Division of Pediatric Orthopedic Surgery here at Washington University. Dr. Schoenecker has done it all. He is past president of POSNA. He's prior chief of staff at the Shrine St. Louis and chief of pediatric orthopedics. Now he focuses his time on taking care of patients and being a mentor. So, Dr. Schoenecker, just a couple of quick questions.
Certainly.
What is your philosophy with education? How do you treat fellows and residents, and what do you try to accomplish with them?
I attempt to get residents, fellows immersed in the activity of being an orthopedic surgeon. In our particular situation, pediatric orthopedic is the name of our orthopedics, and I try my best to get them hands-on, involved, working with them in the OR, working to prepare for operations, following up after operations, evaluating patients in the clinic, working one-on-one or as a group, maximize their exposure to pathology, to patients, seeing how we best deal with approach to problems, accept the best outcome that you can get and go forward with it, work with the patients in a way that the patients are involved in the care, get the fellows, the residents involved and make them understand how important you are in providing care for patients. It's a privilege to do what we do, and that's what I try to tell them.
Perfect. So, quick, more specific question. Tell me how you currently approach the complex hip in a 14-year-old. I know you work with some of your partners and you bring the residents and fellows and get them involved, but it's putting a lot of heads together to figure out the most complex of hip problems.
Okay, first of all, examine the patient, find out what the real problem is, then look at the radiographs, the images, and then get back with your patient, consult with your colleagues if you have to, and come up with the best plan you can to technically take that patient to a better level of quality of life because of your involvement in their surgical care. So get yourself very involved in it. If you have to ask questions about what to do, even at my time in my career, I find that sometimes very satisfying because often I'll ask 2 or 3 people what to do and find out my plan really is the best plan, or sometimes somebody has a little different plan. So get involved, find out what the patient really is bothered by, and that's the goal, to try to fix you as you can the best way possible to get them back to where they want to be.
So I think you've taught a lot of us many lessons, but one of those is the willingness to collaborate. And as you just said, ask questions amongst your peers, ask questions of residents and fellows, learn from everyone around you.
It's hard to become spontaneously smarter. Most of us are not Albert Einstein. You have concepts that you come up with your own, but you get smarter faster sometimes listening rather than talking all the time. You can't get spontaneously smarter. Your hard drive won't get filled up faster with new things unless you listen. Ask good questions, get some information, and you'll do better things for your patients.
Perfect. Last question. I know you believe in the value of repetition, and we all learn when we see things over and over and discuss them again and again and again. And that's how you taught me when I was privileged to learn from you. I believe here at Washington University and St. Louis Children's Hospital and Shriners Hospital, we see a big volume of trauma and challenging problems. And I believe the value in our experience is the repetition.
So important. I mean, you see one good case in September, and if you don't see another one to May, you really don't recall much what you did in September. But if you have a repetition of repeating that foot operation, that hip operation, that assessment of that spine deformity before you go into surgery, the repetition makes you more comfortable. We learn by doing things, and sometimes we learn by coming up with not the best plan, but a mentor tells you here's a better plan. You learn by repetition, particularly in technical events. How do we learn how to play a piano and get really good at it? We practice. How do we learn how to hit a baseball? We practice. How do we learn how to do a difficult hip operation? We're in there working, helping. That's where you become technically proficient, and that's your goal, to become something that's special to a patient that you're proud of being able to do.
Perfect. Thank you.